Hello everyone. I am back with this INICET PYTs. I was not well since last 3 days, so was not able to make the video. Today we'll discuss three questions. So this is the first question which came in INICET 2022. The question reads as which of the following is not a feature of Brown circuit syndrome? One is complete transaction of spinal cord, ipsilateral loss of vibration and touch, contralateral loss of pain and temperature, and ipsilateral loss of proprioception. So first of all, Brown circuit syndrome is another name of hemisection of spinal. The name itself is saying that only one section of the cord is involved. Like, suppose this is the spinal cord, so either right hemisection or left hemisection. Okay? So complete transaction of spinal cord is the wrong answer. Clearly. Okay. Now let us discuss about Brown circuit syndrome. So what happens in Brown circuit syndrome? First of all, let us discuss about three important pathways. Okay. So one pathway is this pathway, which is going posteriorly and on the same side, and this is dorsal column pathway. This pathway carries fine touch, vibration, proprioception. Then we have this pathway which is coming from upward and downward on the same side, and this is corticospinal fibers which carries motor fibers. Okay. Now we have this spinothalamic fibers which is carrying pain and temperature, getting crossing over to the contralateral side and then going up in the cortex. Okay. So when there is hemisection like this, the ipsilateral dorsal column pathways are involved because they are not crossing over. The ipsilateral corticospinal fibers are involved because they are not crossing over. So there is ipsilateral fine touch vibration proprioception loss and ipsilateral motor loss below the level of lesion. While since spinothalamic fibers are crossing over, so there is contralateral pain and temperature loss, and that too one segment below the level of lesion. So from one segment below, like अगर C5 के लेवल पे लीजन है तो from C6 and below there would be pain and temperature loss on the contralateral side, while fine touch vibration and proprioception would be lost just below the level of lesion. Okay, so there is ipsilateral loss of vibration and touch, true. Contralateral loss of pain and temperature, true. Ipsilateral loss of proprioception. These are just below the level of lesion, and pain and temperature from one segment below the level of lesion. Okay. Now, this is the second question. The question reads as a female presented with loss of pain and temperature, but her touch sensation was intact. Okay. Imaging showing cavitation around the central canal. What is the probable diagnosis? Although question में खुद ही बोल दिया कि there is cavitation around the central canal. Okay. So cavitation or cyst-like formation around the central canal or increase in the CSF in the central canal causing a cyst-like lesion is known as syringomyelia if occur in spinal cord and syringobulbia if occur in bulb or brainstem. Okay. Now there is loss of pain and temperature, so it is definitely syringomyelia because pain and temperature के sensations are going through spinal cord. अगर cranial nerve involvement होता then it could be syringomyelia. Okay. Now let us discuss about syringomyelia. So what happens that this is the central canal. So there is dilatation and cyst-like formation in the central canal. Now this central canal is dilating. Okay. Now again हमने pathways three pathways इधर पढ़े थे. So similarly dorsal column तो अपना ऊपर जा रहा है ऐसे. There is no issue at all. Similarly corticospinal tract खुद से अपना laterally जा रहा है. But the issue is there with spinothalamic tract. Why? Because spinothalamic tract have to cross over. Okay. Now spinothalamic tract cross कैसे करेगा? Midline से. Now when spinothalamic tract cross और ये there is dilatation of the central canal, so crossing over नहीं हो पाएगा, so sensations नहीं जा पाएंगे. अब क्या होगा कि जिस जिस लेवल पे ये cyst है, suppose this is the spinal cord, most common side of syringomyelia is cranial. Okay, cervical. अब सर्वाइकल लेवल पे सपोज ये साइनोमाइलिया, सर्वाइकल लेवल के स्पाइनोथैलेमिक ट्रैक्ट दोनों साइड पे क्रॉस ओवर नहीं कर पाएंगे। ओके, सो बिलो द लेवल ऑफ साइरेंगोमाइलिया तो ठीक है, टच, पेन एंड टेम्परेचर सब ठीक रहेगा। जहाँ पे साइरेंगोमाइलिया है वहां के स्पाइनोथैलेमिक ट्रैक्ट क्रॉस ओवर नहीं कर पाएंगे, सो वहां के सेंसेशंस नहीं जा पाएंगे। तो देयर विल बी लॉस ऑफ पेन एंड टेम्परेचर सेंसेशन जिस जिस लेवल पे साइरिंग्स है, और उसके नीचे सब ठीक, और उस लेवल पे टच, फाइन टच, प्रोप्रियोसेप्शन के सेंसेशंस ठीक, मोटर सेंसेशन ठीक। ओके, सो like here we can see that in cervical syringomyelia, upper limb and upper chest region में there is loss of pain and temperature, while fine touch and motor is intact. So this is also known as dissociation. The dissociation is an important feature of syringomyelia. Okay. Now this is the third question, that what is the most common site of abdominal tuberculosis? Rectum, colon, small intestine, ileocecal junction. So first of all, let us discuss about abdominal TB. We have four types of abdominal TB. Peritoneal, which presents as ascites. That ascites would be high sag or low sag, that you have to tell me in the comment section. Then we have lymph node, in which mesenteric nodes are involved. Then we have luminal, this one GI tract, intestine is involved. And then we have vessel. Okay. Now in luminal, the most common site is ileocecal junction. So the answer is D. Now, luminal TB can be ulcerative or hyperplastic. So hyperplastic can lead to strictures, but ulcerative is more common than hyperplastic. Now you have to tell me in the comment section that abdominal TB ulcerative type की होगी तो उसमें किस type के ulcers मिलेंगे, and how can we differentiate it from the ulcers of type 1. Okay, all the best guys.